When I grew up in the 60s and 70s, it was a time when it was a rebound from the 1950s, where in the 1950s you had to have one foot on the floor in TV commercials and TV shows because you didn't show any sexuality. I grew up more in a freer time when there weren't as many rules and when you could make your own rules, and it looked like people really were making the rules. I don't think it was very good for relationships. That was part of the question that was asked, because it was something where women were more comfortable trying to create their own rules for sexual freedom, and it was different. When I first found out about HIV, everyone had to kind of stop and look back and say, what have I done in the past? What were the consequences of what I may have done in the past? And try to figure out if you had made good choices or if you had not made good choices. I'm trying to remember the other questions. After HIV, it was so clear that you really had to be careful, that you had to ask questions, that you should not have any sort of encounter without asking questions, without knowing somebody's status, without protection. When I was first growing up, it was really, were you going to get pregnant, not were you going to contract a deadly disease. There were diseases, but they weren't the type that people were really concerned about dying from. I was not that promiscuous, but it was a big shift after that, and there was first, I think, a lot of rebellion in people who were saying, well, I don't know what I did before, and I think that I'm possibly in danger from what I have done now, but I'm not really going to think about it because I don't want to think about it. I think total denial, people just thinking, I'm not going to worry about this. I can't remember the other pieces of the question that the gentleman asked, but I think that the advent of HIV and AIDS has really made people think twice, and I think now there's actually a swing back, understanding that it's a manageable disease for most people. I'm not sure there's anything else I can remember about the question.